Hi, my name is David Rosenblum. I'm an interventional pain physician and anesthesiologist. I practice in Brooklyn, New York, and I have as a, I guess, hobby slash side project the pain exam board prep, which is part of the NRAP Academy. NRAP stands for Neuromodulation, Regional Anesthesia and Pain. I'm a regional anesthesiologist, and my passion lies with ultrasound guided regional anesthesia as well as ultrasound guided interventional pain procedures, particularly those with regenerative medicine products such as platelet-rich plasma. And being that this is a platform for other physicians, I'm really going to direct this talk to the doctors who are not very familiar with platelet-rich plasma or maybe think it's experimental and not really standard of care. And I'm going to admit on some level that is correct. However, on many levels, that's not completely accurate. First of all, platelet-rich plasma is obtaining a sample of blood, spinning out the plasma and platelets to get a significant increase in the concentration of platelets. Many people will deem 8 to 10 times significant, but there have been definitions just as low as 2 to 3 times the platelet count as being the definition of PRP. That being said, the quality varies from practitioner to practitioner or from processing system to processing system. And therefore, when the research is performed with platelet-rich plasma, it's not standardized across the board. So you need to look at the way it's prepared as well as the concentrations of platelets when analyzing the data. Platelet-rich plasma has been around for probably at least a decade or two, more done in Europe and abroad. But in the States, over the last 10 years, it's become increasing in the frequency and the amount of practitioners performing it. And the evidence is mounting that this is a safe and effective and ethical procedure. Of course, the fact that it's not covered by insurance and the patient needs to pay out of pocket complicates things. And in some ways, it complicates things because it's not accessible to all. However, it actually provides more ethical, higher quality care on two folds. The first is you're giving a homologous product, which is, or autologous product, I should say, that is from the patient. It's not made in a factory. So it's therefore not a drug, has less side effects, is safer, and can give a longer duration of pain relief when compared to steroids. It's been proven across multiple studies and multiple body parts, whether it's knee, shoulder, hip, spine. It's being seen across the board. Now, of course, it doesn't work the same for everything. I would say platelet-rich plasma is definitely more reliable for the knee and shoulder than the hip, and it's definitely more reliable in younger patients, just like almost any other therapy, like steroids. But there's also another aspect of platelet-rich plasma, or these, I guess you could say, just cash procedures in general, that has an added advantage when comparing it to something like an epidural or a trigger point or a medial branch nerve block, which when the insurance is involved. And the extra benefit I tell my patients is many times spine pathology, for example, back pain, sciatica, leg pain, is multifactorial. You have a disc that degenerates. It causes a sciatica because the nerve root is inflamed from the inflammatory mediators being released or the compression of the nerve. And you have a coexisting arthritis of the facet joint with muscle spasm. And the pain may not be strictly a nerve root issue, may not strictly be a discogenic pain. It may not strictly be a facet arthritic back pain. When you take the insurance company out of the equation and you're dealing with a material like platelet-rich plasma, which you can work with the quantity you have, but you're not limited like you would be with a local anesthetic that has a toxic level. You're just limited by the quantity that you have. You're able to address multiple aspects of the pain right then and there, meaning patient comes in with a backache to the leg, you're either getting an epidural or a medial branch block or a trigger point. You're probably not getting approval from the insurance for multiple injections on that same patient on that same day. And that's how it is in the United States. In other countries, physicians can do multiple injections, and it's acceptable to do an epidural with a facet joint injection. It was like that 20 years ago in the States, but the insurance companies have become much more restrictive. When you're doing a regenerative medicine procedure such as platelet-rich plasma, not only are you giving a therapy that is proven to help. I mean, at this point in time, it is proven. So it's considered experimental by insurance companies that don't want to pay. And yes, it still is experimental to some degree, but when you look at the big picture of pain management, most things are experimental in the sense that you're going to try something. Maybe it'll work, maybe it won't. If it doesn't, it will give you information to try something else. But the the idea is you could give platelet-rich plasma, inject the epidural space to alleviate the radicular symptoms, put some in the facet joint, alleviate the arthritic complaints, and put in the needle in the trigger point or even in the disc if need be, which is more invasive and risky, by the way. But you could actually do better for the patient. You could actually do what they need right then and there and hopefully avoid them from needing surgery, suffering, or needing more injections. I find that the patients who have successful outcomes from platelet-rich plasma do not get as many injections. They do not get as many treatments of medications as my other patients. And the relief lasts longer than the steroids. So when people say, oh, PRP is just a way for doctors to make money, actually, in some ways, it's not, because patients actually get better, which is our goal. And they are not coming back every month for an opiate or, and this generally speaking, of course, or repeat shots, or maybe you alleviated their sciatica symptoms, but their back still hurts and you need to do facet treatments now. So in the end, you actually can help solve the patient's problem. I strongly believe in platelet-rich plasma. It doesn't work for everybody, it doesn't work for everything, nothing does. However, I'm a pain patient. I've had these treatments on my own spine, on my joints. And if you ask anyone who's doing PRP and using the high quality PRP, not the $10 test tube, the real kits that offer a double spin technique with the ability to concentrate to levels at least 8 times what is normally seen in the blood, you're finding that they're seeing superior results anecdotally, and many of the studies are proving it. So for the doctors who are not familiar with platelet-rich plasma, feel free to contact me anytime. I teach courses on this. I am pretty up to date with the literature. We have guidelines now from the medical societies. I don't know if this will ever be covered or if this will be covered in the near future. When these procedures work, people generally get better. Do they need to repeat the injections? Sure, sometimes, but they tend to be safer, last longer, have less side effects than corticosteroids, and they could help alleviate some syndromes that may often debilitate patients to the point of needing surgery, such as rotator cuff tears, or they may help with postoperative pain. I've seen the wide gamut, and I've used PRP everywhere from pretty much the foot to the head. So it's a very safe therapy for the patients who do not have financial barriers to this therapy. It should be one of the first line therapies after conservative therapy fails. For those who unfortunately have financial barriers, well, it's a big problem, and hopefully one day the payers will start to reimburse for this, because it really is a an ideal ethical therapy that should be considered for most patients. If you want to, if you're a patient listening to this, you could find me at www.aabppain.com, or my office number is 718-436-7246. If you are a physician and you're looking to learn about ultrasound guided procedures, you can check out my website, NRAP, which stands for Neuromodulation, Regional Anesthesia and Pain, nrappain.org. Or you can email me at info@nrappain.org, nrappain.org. And I'll be more than happy to give you the information or set up a training. This is the future of pain medicine, and it's here to stay, along with a lot of other great therapies that have recently come to be FDA approved or developed and available for you. So pain management is not going anywhere, and there's really better therapies being developed every year. So just stay tuned. If you're not finding the solutions to the pain that you or your patients are suffering from, check back in a few months, because I might have a completely new and different way to go that may be safe and effective. Thank you, and I wish you all the best.